Hi everyone, my name is Jessica Millat and I will be presenting Chapter 10, Behavioral Health Services from Salt & Young's Healthcare USA. In the early years of America, the mentally ill were confined at home, in jails, or in almshouses where they received no care. In the year 1817, the Quakers in Philadelphia established the first freestanding asylum where people with mental illnesses could receive kind but firm treatment while engaged in work, education, and recreation. Fast forward to the 1940s, state-operated psychiatric hospitals were the main form of psychiatric care. By the mid-1950s, the public psychiatric hospital population peaked at more than 500,000 people. In 1955, Congress established the Joint Commission on Mental Illness and Health. The commission attacked the quality of care and inadequate patient access to care in large states and county psychiatric hospitals. Later on in 1963, Congress passed the Mental Retardation Facilities and Community Mental Health Construction Act, resulting in new federal support for community-based services. Subsequently, entitlement programs such as Medicaid and Medicare became accessible to the mentally ill in 1965 and supplemental security income by 1974. In 1990, the locus on mental health care in the United States had shifted from inpatient to outpatient settings, and an increasing amount of Americans were seeking mental health help. Psychiatric illness is widespread in the U.S. population, and the most recent statistics from the National Institute of Mental Health reports that approximately 44 million, or 18% of American adults, experience a mental illness in a given year. Neuropsychiatric disorders are the leading cause of disability in the United States, surpassing cardiovascular disease, cancer, and unintentional injuries. In 2014, federal estimates project expenditures on mental health and substance abuse treatment alone were estimated at $239 billion, which is an increase of $121 billion, or 49% since 2003. In contrast to widely held assumptions, psychiatric disorders can now be diagnosed and treated as effectively as physical disorders. According to the National Institute of Mental Health, nearly half of those with any psychiatric disorder meet criteria for 2 or more disorders. It was found that mentally ill individuals have great difficulty in identifying and connecting with medical care services, and even when they do so, many have overwhelming challenges with complying with treatment plans. These circumstances often result in mentally ill persons delaying care and developing medical complications. Treatment and care for mental health-related issues is provided in a variety of settings. The environment and type of care will depend on multiple factors. Psychiatric hospitals treat mental illnesses exclusively, although physicians are available to address medical conditions. A psychiatric hospital might have specialty units for eating disorders, geriatric concerns, child and adolescent services, as well as substance abuse services. Outpatient clinics are settings where patients obtain therapy services from a variety of mental health professionals. Depending on the particular clinic, individual therapy, group therapy, and medication management may be available. General medical and surgical hospitals may have a psychiatric inpatient unit and/or a substance abuse unit, although these units are not very common. They provide medical services that would be available in a freestanding psychiatric hospital. Residential mental health treatment environments generally provide long-term care for individuals. Most residential treatment settings provide medical care but are designed to be more comfortable and less like a hospital ward than inpatient hospitals. Examples include psychiatric residential centers, alcohol and drug rehab centers, and nursing homes. Community mental health centers, often referred to as mental health and mental retardation centers, are clinics that treat persons whose income fall below a state-determined level. Many individuals see a mental health professional in solo or private practice at the practitioner's office for mental health treatment or counseling. Appointments may be for individual, group, or family therapy. Telepsychiatry, telemental health services refer to the remote delivery of psychiatric assessment and care, or psychological support and services via telephone or the internet using email, online chat, or video conferencing. Most commonly, these services improve access to care for individuals with mental health issues living in remote locations or underserved areas, or even those who can't leave home due to illness, emergencies, or mobility problems. Often, individuals with severe symptoms or complex mental disorders are treated most effectively with a combination of psychotherapy and medication, sometimes complemented by additional treatments as well. Psychotherapy and psychosocial treatments may be part of an overall treatment plan for people living with psychiatric disorders or other mental health conditions. These treatments may also extend to their families. Psychosocial treatments include certain forms of psychotherapy, also known as talk therapy, psychoeducation, and even vocational and social training. Psychosocial treatments for mental illnesses can help individuals improve their functioning while lessening the negative effects of their illnesses. In addition to medication, psychotherapy and psychosocial treatments, several types of brain stimulation therapies, are valuable tools for managing and treating some mental disorders. These interventions involve touching or activating the brain using electricity, magnets, or implants. Electroconvulsive therapy, or ECT, is the most researched and effective stimulation therapy and has the longest history of use. Even in behavioral health, there are multiple factors associated with lack of access to care. They include provider geographic distribution, financial limitations, lack of or inadequate health insurance, stigma, misunderstandings about treatability of conditions, personal and provider attitudes, cultural issues, and a poorly organized care delivery system. Patients with a mental illness and a substance use disorder experience additional barriers secondary to the stigma associated with substance abuse. The general community and even providers tend not to view substance abuse and addiction as a chronic illness, but often instead attribute casualty to a lack of will or a moral failure. The psychiatric and behavioral health sector consists of behavioral health professionals such as psychiatrists, psychologists, psychiatric nurses, psychiatric social workers, and behavioral health clinicians working in outpatient settings. More recently, providers are hiring peer specialists who are people with a psychiatric or substance abuse disorder who are trained to help others in assessing care and developing a recovery plan. Early reports suggest that peer specialists are particularly helpful in enhancing treatment compliance and community integration. Within the last 5 years, there have been 2 paradigm shifts directed towards turning the de facto mental health system into a more integrated and effective system of care: the recovery-oriented systems of care and integration of primary care and behavioral health. The recovery transformation of the mental health system was first introduced in 2002 by the Freedom Commission on Mental Health. The Recovery-Oriented Systems of Care, ROSC, provides a holistic and integrated approach to care seeking to enhance a person's positive self-image and identity. The overarching goals in ROSC are to empower mentally ill people through the provision of choices and a vision of a hopeful future. The ROSC shifts care from the old episodic care model to one that emphasizes continuity. Both providers and individuals are encouraged to focus beyond systems of mental illness and articulate needs and desires for housing, utilization of public transportation systems, employment, leisure activities, or even a weight reduction strategy. More than 60% of people with psychiatric illnesses are unable to access any kind of psychiatric care, and more than half of those who do access and receive care in primary care settings. From the perspective of the primary care providers, there is a great need for consultation from psychiatrists and behavioral health specialists. Yet, psychiatrists and other behavioral health professionals have traditionally not been involved with the primary care treatment team. The Affordable Care Act provides the mechanisms and funding for massive expansion of insurance coverage, and the individual mandate for health insurance coverage requires that if the insurance plan provides coverage for psychiatric and behavioral health care, that coverage must be equivalent to that provided for non-psychiatric medical disorders. However, an insurer is not required to offer coverage for all behavioral health conditions. Hence, insurers are able to continue decreasing access to services for behavioral health care. Financing is a critical factor in the realization of a viable mental health system. It is the mechanism whereby plans and policies are translated into action through the allocation of resources. Mental health services are funded in many ways, including private health insurance, Medicaid, Medicare, state and county funding, as well as contracts and grants. While there are numerous options for funding, behavioral health can be pushed aside. As in other healthcare sectors, managed care programs were designed to control costs through financial incentives which reward outcome of care, not service utilization. Managed care systems for people with mental illnesses tightly control utilization and can closely monitor heavy users of mental health services. They often did not incorporate coverage for mental illness in their basic contracts due to the costs of chronic care. Public sector initiatives have paralleled private sector efforts in using the subcontractor known as Managed Behavioral Healthcare Organization to control costs. Today, approximately 1 in 5 adults suffer from mental illness in the United States, and this number is expected to increase in the years ahead. At the same time, there is a growing shortage of mental health providers and resources to treat these individuals, and the gap between demand and supply is continuing to grow. A report published by the National Council for Behavioral Health estimates that the shortage will be between 6,100 and 15,600 for psychiatrists alone by 2025. This creates an enormous strain across the entire healthcare system, most notably for emergency departments, primary care physicians, and underserved rural areas. A study published in the American Journal of Preventive Medicine revealed that 65% of rural counties don't have a psychiatrist, 47% don't have a psychologist, and 81% don't have a psychiatric nurse practitioner. Without access, it is not even possible to evaluate mental health services as a part of a preventative care plan. The National Council for Behavioral Health Medical Director Institute has concluded that the traditional model of psychiatric care for delivery is unsustainable. In 2019, America will witness a new wave of digital care solutions that are filling a massive void in the market by transforming healthcare delivery. Designed to bridge the current gaps commonly experienced while seeking care, digital mental health platforms effectively remove the barriers that prevent patients from accessing services, including a lack of clinicians, limited transportation, privacy and stigma concerns, expanding access to care while providing effective, accessible, and affordable mental health resources. As a result, this digital care model is expected to fundamentally change the way healthcare is delivered across the care continuum and play a critical role in helping payers and providers distribute convenient, outcome-based, patient-focused care across the mental health care spectrum, including the hard-to-reach and high-cost behavioral health populations. Patients will receive the right care at the right time in the right setting, contributing to an improved patient experience, lower costs, and better outcomes. And that's my presentation on Chapter 10, Behavioral Health Services from Sultan Young's Healthcare USA, Understanding its Organization and Delivery. Thank you.